Without further ado, our next speaker is Dr. Danielle Kurtin. Danielle is a research fellow at Imperial College London. She did a PhD at University of Surrey and Imperial College London. She works in brain psychiatry, brain sciences and psychiatry, and has worked on characterizing mechanisms of addiction and psychedelics for therapeutic interventions. And today she's talking to us about personalized brain stimulation for addiction. Take it away, Danielle.
Thanks, John. Hi, everybody. I am really excited to talk to you about how we can evaluate the efficacy of personalized brain stimulation for addiction, or if we want a short and snappy title, the quest to be useful. And I've called it that because we may be familiar with the first part of this very famous quote by George E.P. Box, "All models are wrong, but some are useful." But I'm more interested in the second part of the quote, which then says, so the question is not, is the model wrong? It almost invariably is. But rather, is the model useful for its purpose? And so the question that I'm asking today is, can we utilize models in a useful manner to inform effective, personalized brain stimulation for addiction? And so before I begin, I'd want to thank everybody who's been really core and instrumental in helping me put together this body of work, and to state that I have no disclosures. And I'd like to start as well by the motivation for this project, which is that we are currently not effective enough at treating addiction, right? So almost 70% of people will relapse despite receiving treatment within 6 months. And we can look at the treatment landscape for addiction and see that it's largely psychological, and there are some pharmacological interventions. But many of the psychological therapies for addiction include a lot of the cognitive, top-down, inhibitory, goal-directed processes that are indeed affected by addiction, but are actually a bit downstream of what we can refer to as the urge to action framework. So in 2017, Catherine Dunlop published this brilliant review that looked at how you have different neural networks or coalitions of brain regions that work together to subserve a process, and how they can be affected in addiction and lead into one another in a directed manner. So this is just a theoretical framework, but I find it quite a useful model to understand how actually some of the most core pathology of addiction, right, disrupted reward and anti-reward circuitry, could drive the coordination of networks that shape cognition, attention, inhibition, what have you. And historically, we've only been able to deliver non-invasive brain stimulation to cortical areas that are really commonly associated with cognition and goal-directed planning. But again, we just highlighted how that's a part of the existing treatment landscape that doesn't suffice. So we would ideally be able to target deeper brain circuitry central to the ventromedial network or reward and anti-reward networks. And thanks to new neurostimulation technology, we can. So I first want to highlight the incredible work by Daisy Thompson-Lake in West Virginia University, who's utilizing focused ultrasound stimulation to target the left nucleus accumbens and modulating not only the proposed network representations of addiction proposed by Catherine Dunlop almost 10 years earlier, but some of the most astounding remission rates I've seen. So as aforementioned, I work with temporal interference stimulation, so I'm quite excited to explore how this novel, or I guess not so novel at this point, modality of non-invasive brain stimulation that can create electric fields deeper within the brain might be used to effectively modulate processes disrupted by addiction. And I know this is a bit of a glib slide, but does it do much of anything? But I do want to be honest about the fact that stimulation's effects are often a bit weak. They're highly inter-individual in terms of their variability. And, you know, we're all, I think, here in agreement that perhaps personalization may be an effective strategy to improve targeting and therefore outcomes on both brain function and its associated behavior. And we can also come to agreement that models are an effective way to iterate over this large parameter space of where to target, how to target, what waveform to target, what amplitude, what frequency, on and on. So in order to do this, I've structured a bit of a pathway to generate predictive stimulation parameters. And the first is not to build a model. The first step is actually to identify useful brain behavior relationships relevant to the processes you'd like to perturb. And so in the first half of this talk, I will introduce my strategy for understanding relationships for these different networks that are affected in addiction and the relationship to a measure of task performance, so behavior, and some open questions within this pipeline. Then we can move on to modeling, right? So once we have an individualized understanding of a measure of brain function that best relates to a participant's task performance, we can build and optimize models according to that target metric that is most useful for that participant for their task performance. Then finally comes perturbation. We can look at which brain region within that target metric, or spoiler alert, between network connectivity, best can shift that target metric or between network connectivity in the direction that relates to improved task performance. And as aforementioned, this work is constantly in development, so if there's anything that you see that we can improve upon, I'm excited to hear it. But first, if we've talked about the effects of brain stimulation are important in a context-dependent manner for coordinating neural processes and shifting neural networks that underpin them, we need to set the context for the data in which we're talking about, which is during the Iowa gambling task. I've come to love this task because it utilizes coordination between networks that all are both affected by addiction and contribute to the behavioral task performance measured by this task. And so in this task, you would be, if you were all participating in the experiment and you all got in the scanner for me, you would be shown 4 decks of cards, and you could choose 1 deck of cards for every single trial, and you would wait a minute, and then you would see whether you had won money, lost money, or both. And reliably, people with addiction tend to choose one of the 2 decks of cards that maybe they have higher rewards, but they have higher losses as well, and you lose more money over time. Whereas healthy controls tend to pick more advantageous decision-making strategies and tend to choose decks of cards where you win more money overall. And there's a lot of beautiful cognitive and computational modeling that can relate these measures of task performance to trait-like features that are impacted within addiction. And I thank Andreas Haugland for his code and support with this, but we're going to focus on the explore-exploit weighted parameter, which is one that can help capture this explorative, exploitative, advantageous, disadvantageous decision-making on a trial-by-trial basis. Great. We have our target metric to maximize explore-exploited weighted. Now we need to ask for each subject which neural metric or between network connectivity, which sits at a kind of, I feel like, a happy medium of a spectrum of metrics that very usefully capture how information over space and time coordinate and relate to behavior, right? So we have information theoretic metrics, complexity metrics, turbulence metrics, but they're less controllable or mechanistically understood. Then we could go to the opposite end. We have really robust biomarkers of addiction, activity in the nucleus accumbens during reward and anti-reward processing, but it's a very isolated measure. So this is my happy medium for now to relate, to look at how during a task, how maybe different networks that coordinate processes in parallel may relate to task performance. So in order to build these models, I'll kind of be a bit brief and for time's purposes, but we would extract bold time series for regions from atlases transformed to subject space, and after Hilbert transforming it, you could compute the cosine of the difference in the phase angle at every single volume, giving you a coherence matrix for every single volume. You can then average together the edges within and between each network, generating a coherence matrix for every single volume, and enabling you to then average together the between network connectivity for all the volumes within a trial. So now we can finish step 1, which is identify which between network connectivity best relates to explore-exploit weighted. I have been exploring how many different types of models we can use to do this in a reliable and robust manner, and it's still a very open question. This is just a small selection of approaches, but just to give you some idea of what results may look like, this is my distribution of between network connectivity when I performed this task, and some relationships between network connectivity to my explore-exploit weighted. And so for me, my target neural metric would be to stimulate between my ventromedial reward and anti-reward network to my somatomotor network. And so we can go through data from the remaining pilot subjects later if you're interested, but in the interest of time, let's explore how we can build these models. And so we're going to focus on phenomenological models rather than biophysical today. And we're going to be using a Stewart-Landau model. So some shout out and thank you to Jakob, Gus, and Yoni for helping me with the code to develop these whole brain, virtual brain twins, if you will. So after initiating model parameters, we start with this standard approach of generating model outputs, first by setting the connectivity between regions with a structural connectivity matrix, and then computing the error in the generative time series between the group empirical functional connectivity and the simulated one. It's then updated with a learning rate, and that sets a bit of a prior for then individualization. Now, typically, you would repeat that same process, but with individual functional connectivity matrices and the simulated functional connectivity matrix. But here is where we put our little twist on it. And we focus on the target metric. So again, for my data, that would be the ventromedial network and somatomotor network connectivity. And we would compute the error not as the difference between the model simulated connectivity from the whole brain connectivity matrix to my empirical one, but rather the difference in connectivity between those two networks in the simulated versus empirical. And we're playing with different proportions of updating and learning rules for the connectivity for the matrix as a whole versus the target metric. And spoiler alert, it's well, okay, if you want to learn more about the relationship of how effective it is to focus on the target metrics versus whole brain, that we can chat later. Because I want to make sure we have time to talk about how we can model stimulation and perturbation. So in Stewart-Landau models, there is the bifurcation parameter, A or alpha, and as you increase it over 0, it models something nice like the entrainment of a region to continuous electrical stimulation. It generates limit cycle activity that may be a bit more stronger and perseverative. And so we iterate over a range of values of alpha, and we do what we did initially, which is generate the simulated time series, but now we again compute the mean target metric across all of the different instantaneous functional connectivity matrices per trial, and we'd get this lovely stimulation landscape of the connectivity within that target metric for all of the regions we'd like to stimulate, for all of the values of alpha, and the value, or rather the value of alpha in the target metric region that generates the greatest connectivity within our target metric is our personalized stimulation target. That would be great if this was the end, but indeed this is only the beginning of the empirical testing portion, especially because this is our personalized stimulation target, but our question is personalized stimulation also better than generic stimulation? I'm not necessarily convinced it is. It might be more convenient if it isn't. It's more scalable to have a one-size-fits-all neuromodulation approach. So in my remaining time, I'll very, very briefly just highlight a pipeline that we can use to identify the electrode configuration necessary to target both your personalized stimulation region and your generic stimulation target. So thanks to the ETIS Foundation's TI planning tool, I've got some outputs from their beta version, and there's a more updated personalized version as well, where again we have, I just put my brain up there with my co-registered T1 and diffusion-weighted imaging and a mask of my left nucleus accumbens. So that will be the generic stimulation target in alignment with Daisy Thompson-Lake's work, so we can have a nice comparison. And this can help inform where one would need to configure electrodes to generate the electric field in your target region. So to answer the question, is our models useful at generating personalized brain stimulation parameters? Since this work is still ongoing, I argue that we are not yet useful, but we are on the right path to becoming so. And I'm really curious to have discussions later to help ensure that this path continues to be a useful one. So please reach out after, and thank you for your time and attention.